Hello and welcome everyone. I'm Thais Carter, Director of Content for Advanced Star Dental Media and moderator for this evening's program. I want to thank all of you participating in this webinar, Are Diode Lasers Worth the Investment?, presented by Dr. Todd Snyder with help from our sponsor, AMD Lasers. On behalf of Dental Products Report, I'd like to thank Dr. Snyder for taking the time to join us and share his presentation. And we want to take a quick moment to introduce you to our presenter. Dr. Snyder attended 3 years of college at the University of California at Riverside, forgoing the last year and a Bachelor's of Science degree to enroll early into a dental school. Dr. Snyder received his DDS in 1994 from the University of California at Los Angeles School of Dentistry. He subsequently completed a general practice residency at the VA Medical Center in La Jolla, California. In 1995, Dr. Snyder returned to the UCLA School of Dentistry. As faculty in UCLA's Center for Aesthetic Dentistry, he co-developed and was co-director of the first and only 2-year postgraduate program in aesthetic and contemporary restorative dentistry. He went on to work in the section of biomaterials at UCLA until 2000, where he had tested and provided research on various materials in the dental industry. Dr. Snyder is currently a faculty member at Aesthetic Professionals Training Facility in Los Angeles. Dr. Snyder distributes his time between private practice, teaching, and research. His research deals with all facets of contemporary aesthetic and cosmetic dentistry, dental materials, and techniques. In addition to lecturing internationally, Dr. Snyder has authored articles for various dental journals and writes correspondence courses for home study continuing education. Furthermore, Dr. Snyder is a consultant and clinical evaluator of materials and products for many prominent dental manufacturers. His current focus is on educating and advancing the field of contemporary aesthetic, cosmetic, and adhesive restorative procedures in clinical dentistry. Now, before I give Dr. Snyder the floor, I need to go over a couple housekeeping items. You'll notice a box on the bottom left. This is where you can enter questions at any point in time during the webcast, and at the end, we'll spend 10 to 15 minutes on Q&A. If your question is not answered, you will receive a response via email this coming week. If you're having any technical issues, you can submit your question using the presentation interface, and a technical support member will assist you, or you can hit F5 to refresh your screen. If anyone needs to leave in the middle of the presentation, this webcast will also be available on demand on dentalproductsreport.com starting Friday, October 26th. And with that, I will turn things over to Dr. Snyder.
Thank you so much, Thais. Well, welcome everyone. Thanks for being with us this evening for this packed hour of entertainment on lasers. I know this is what you want to do in your weekly schedule. I'm hoping I can shed some light on why lasers may be a very good investment for you in this time and age of our economy, as well as just helping out your patients. So I want to hopefully, by the time we get done, get you to understand why these are a really good investment. And as minimal investment as it is, there are so many things you can do with these that you are currently not doing or taking more time to do. So hopefully you'll see all that by the time we get finished. So the first question I get all the time is, why a laser? And can you get good results with these things? And laser's been around for a long time. I've had just about every laser out there, and still have many different types over the last almost 20 years now. So I've seen a lot of things change. I've seen them become a lot more affordable as technology gets better and easier to fabricate. So it's a great time to get into lasers for various aspects of dentistry. As far as results, I'm hoping you're going to see how amazing some of the results can be and how easy it can make your life in the dental office, so you can see more patients in the day, be more productive, and not get so stressed when problems arise when you deal with various types of tissues and fluids in the mouth. From there, I oftentimes get asked, are they affordable and do they pay for themselves? There's a lot of things we buy in dentistry, and this is one thing that really is phenomenal as far as getting a good return on an investment. And as far as being affordable, you'll see in some slides coming up how affordable they've become compared to when I got into the game about 18 years ago. So there's a lot of things we like to have or we desire to have in this world, and many of them don't make sense, but they're wonderful luxuries we like to have. These are just some of the many ones I'd love to have, and I'm sure many of you would like to have some of these as well. These don't always have a solid foundation as to why we want them, but we usually find a way to make them happen. Usually if there's something you need, if you work hard enough and you strive for things, you can make it happen. And ladies, you're no different. There's things that you like to have as well. We know what they are. And all these luxuries make you look great, but they're not necessities. And of all these different things that are out there, we can afford these based on the procedures we offer to our patients, but to create a win-win for our patients and ourselves allows us to achieve many of these items that we all desire. Now, taking desires aside, there's things we need. And so things we need are entirely different because they obviously make us work a lot easier, and give us less stress, and allow us to basically provide the financial means in which to buy these desired objects. So feel-good investments that have no rhyme or reason are wonderful, but we need to have these types of investments to help us out. So whether it's doing direct or indirect restorations, I'm sure most of you are wearing magnification. If you're not, it's amazing what you're not seeing. But you can all imagine if you had to go into practice tomorrow or Monday and didn't have your magnification, how difficult would it be to work on, let's say, a first or second molar, trying to get around that distal contact point or down at the gum line and see very well that you have a nice defined margin. We know it can be very challenging by not having these tools. Hence, many of us may even have a backup set of magnification to make life easy. From there, placing composites. They're time-consuming and very difficult to get great contacts, and yet we have wonderful tools like trio-dent sectional matrices that can create nice tight contacts for us regularly without any concern of not getting a tight contact. From there, we all have different types of radiographs. Digital technology has made life a lot easier to have less radiation and get in and out more quickly and to see more things for diagnostic purposes to keep our patients healthy. If we took all of these things away, how difficult would our practices be? We're accustomed to having these. They make us feel good. We can be more productive. Think about your root canals. How many of you are currently doing root canals and have wonderful technology that has apex locators, forward and reverse automatic sensors, maybe wireless handpieces? There's so many things that make life easy. Now, I don't do root canals anymore, but when I did, this is what I was using. I can't imagine having to go back to these hand files and doing the whole procedure with hand files compared to using modern devices. So the reason I bring up these pieces of information is because for the most part, one or all of these we typically use in our practices. So you can identify how difficult life can be with any one of these being taken away or various other tools that you use in your practice every day that if you didn't have them, knowing what you know life would be more difficult in the practice. And that's where lasers are kind of brought into the fold. There's many things that lasers do that you may not realize they can do for you, your practice, and your patients, and your bottom line because you haven't invested in one yet or tried one yet. So the reason we're getting into this is so that you can understand better the things that you're potentially missing and what could be gained by having one. So in dealing with soft tissues, there are various things that we have on the market. Lasers have changed in many different ways. AMD Lasers are kind enough to sponsor this tonight. I'm showing you now their Picasso laser. We're going to get more into it coming up. But this is one of the things that's going to be able to manage soft tissues in your practice. So from here, this is a wonderful paragraph that I stole from another laser company. Basically, I get asked all the time about lasers and what they can do, and I thought this was the most concise paragraph of what lasers can do in our practice. So although I know you can read it, I'm going to just go ahead and read it for you. A laser is more precise, causes less pain, prevents bleeding better than traditional tools used on soft tissues. The highly focused laser light cauterizes nerve endings, coagulates blood vessels, sterilizes the surgical site, and increases the speed of healing for the patient. Instantly cauterizing nerve endings greatly reduces the pain during the procedure as well as afterwards. Healing times can be as low as a few days, whereas traditional surgical approaches can take several weeks, and or the patient having to return potentially to remove sutures or to treat an infection. So there's a lot of things here that you can avoid simply by introducing a laser into your practice. But from there, it's helping you by moving more quickly and also having the patient maybe having less discomfort and problems because of sterilizing things as well as coagulating nerve endings and blood vessels. So there's a lot of upside to everybody in implementing these into your practice. Now let's look at kind of a timeline. When I got involved with lasers, it was in dental school just at the end of my schooling in '94. And I bought this huge 45-pound laser at $35,000 right out of school with debt because I recognized what it could do for me because they put it in my practice for 60 days. And so at 60 days' time, without ever having paid for anything, I had already made enough revenue that I could see the potential in this. Now, granted, I didn't make enough revenue in that little amount of time to pay for the $35,000 device, But the devices nowadays are about $2,500 and can do virtually the same thing that that laser could do in '94, albeit they're smaller and easier to utilize. So you'll notice in the timeline here that there's numerous different iterations that have occurred over time, with, you'll notice, the price and the sizing getting smaller. Now, when you think of lasers, my best analogy is to pick something that we all deal with every day, something like a Blu-ray player or a DVD player. They all will play the movie. It just depends on how many bells and whistles you want to have for that movie to be played, whether you want the THX sound in your DVD player, whether you want it to be connected to the internet or Facebook. There's all these little bells and whistles that can be tied into your DVD or Blu-ray player, depending on which one you purchase. And you're typically going to pay more for each one of those that have more bells and whistles. So in looking at these newer devices, they do have a lot more bells and whistles than some of the older ones, but they've made them more simplified and compact and easier to utilize, and yet the price is still low. So rather interesting. So the one we're talking about tonight is the AMD Picasso lasers, which their Picasso Lite, their smaller one, is about $2,500. So very inexpensive to get into the game compared to the $35,000 that I had paid previously. And there's other interesting diode lasers out there on the market too. Don't get me wrong. There are many other ones that are the size of a cigar or slightly bigger than the AMD product that are anywhere from $5,000 or $4,000 on up to like $12,000, $13,000. To some extent, you'll see that you don't need all of that. My best analogy for that is, guys, we all look at these cars and we drool thinking, oh my gosh, how nice it would be to have a fancy sports car like these. Well, here out in Los Angeles, having a $1 million car that can go 0 to 60 in 3 seconds isn't going to get you through traffic faster. It doesn't do anything more other than drain your pocketbook, but it sure would be nice to have. So lasers, you don't need to spend a lot of money to get a lot of bells and whistles and a lot of horsepower, so to speak, because you don't need all that. It takes a very minimal amount of energy and time in which to modify tissues. So don't think you have to go big when you make a purchase. So let's talk more about lasers. Now, lasers have a way of interacting with the teeth and the tissues in many different ways. They can be reflected off the teeth and the tissues and or your metal instruments. They can also be transmitted or scattered through the tooth and through the tissues. So in utilizing lasers, we can get a lot of different responses depending on what we're trying to have happen. Sometimes we want to cure various types of resin materials. Other times we want to take away tooth structure using hardened lasers. But tonight we're more interested in soft tissue modifications, things we can do with diode lasers. So although we can do a lot of wonderful things with many different types of lasers to the various types of tissues and materials we use in the mouth, what we're really concerned with tonight is the way that the diode lasers interact with the melanin, the hemoglobin, and the moisture in our tissues to modify them to make it more simplified in our daily procedures. So in utilizing lasers, we have various types of tissue interaction. If you have a diode laser in front of you, let's say, for example, the AMD, since we're talking about that, if you have it set, let's say, at a 5-watt setting, at 5 watts, depending on how close you have that laser to the tissues, you can do various things. So if you're very close to the tissues, like you can see on the right-hand side, it's the same exact system, but you're closer. And by being closer to the tissues, you have a smaller spot size, so you have a lot more energy going into the tissues. You'll get a different type of tissue reaction and response than you will than the left side, which is further away. And so just think of your ordinary flashlight. If you have a flashlight shining at a wall and you're 20 feet away from the wall, you'll have a very large circle that's fairly faint. And as you get closer and closer to that wall, the circle gets smaller and more intense. That's your laser, okay? So depending on what you want to happen to the tissues, depending on how close you are, you can make various things happen. Now from there, we think of basically removing tissue in a different fashion than we think of with scalpels and or electrosurgery devices. Now with electrosurgery devices, we typically have a lot more damage to the tissues, and we have a zone of necrosis around that tissue damage. So we get a fairly large defect by using a cautery tool compared to using something like a laser. So out of all this potential damage from an electrosurgery device, it takes longer for things to heal, and you have more risk of potentially tissues being modified to a less desirable position. Maybe they recede a little bit in the cosmetic area. Maybe there's a little more tenderness in certain areas. But we've used electrosurgeries and radiosurgeries, and they do work to modify tissues, albeit there's other tools like the laser that do a better job. So rather than removing 300 to 500 cell layers with something like an electrosurgery unit, we can go in with something like a laser and take away tiny little amounts of tissue to modify just what we want to be very precise. And so in taking away a couple cell layers, we have minimal thermal damage to adjacent tissues. So whether it be something in a very delicate cosmetic zone or something potentially that needs to be biopsied, we know that in utilizing these, we can have tissues that look very good and be very healthy, whether we're trying to get something to be cosmetically pleasing or we want to get a good report back from the pathologist saying we can see clear borders and the borders have not been damaged by thermal insult from some type of laser or cautery device. So to take that a step further, based on the size of the laser fiber you're using, because there's different fibers the same way we have different widths of dental burrs when we're cutting teeth. A larger fiber, obviously, as you can see here, is going to take more tissue away, and it's going to have a little bit bigger zone of necrosis around it. And so as you get a larger zone of necrosis and or larger heat dispersion, you can have more damage put into the tissues depending on how you're utilizing it. Versus a smaller fiber maybe set at more of a pulse setting, again, you can take away very small amounts of tissue and be extremely precise in how you handle the various tissues in the mouth. So you look at this slide here of the epithelium. You can see basically the epithelium as it has been lasered. They vaporize some tissue, and you'll notice the little bit of kind of pink around the area that has been removed or vaporized. That little tiny bit of pink is the amount of temperature change, that little bit of damage that occurred that happens basically when you use a laser, that little bit of heat dissipation into the adjacent tissues. Now you can imagine how tiny this is, that a couple cells really isn't causing much damage, and if you're a pathologist and you want to look for clear margins, you'll be able to find them on this. All right. So moving on. Obviously, we talked about if you're getting too close to the tissues, you're going to, or sorry, not too close. If you're getting very close to the tissues, you'll get obviously changes in the tissues based on the thermal insult that's happening. So just know if you're further away if you're further away, you get about 37 to 60 degrees of temperature going into the tissues. You're just going to get some warming. You're going to get some bacteria basically being killed off at about 50 degrees, but you're getting warming and some bacterial death in the area. From there, at 60 to 100 degrees, you're going to start getting some protein denaturization, potentially some coagulation if you have bleeding, and you'll get some tissue shrinkage. That tissue shrinkage is important, as you'll see when I do a biopsy later on. Now, at 100 degrees, you're going to get vaporization of tissues. You're also going to get tissues just being eliminated, disintegrated. If you stay in one spot too long, though, you're going to get a lot of temperature increase. And from that, you're going to get carbonization and or burning of the tissue, which you'll see a little bit of carbonization coming up in one of my slides. Just know that the heat energy going into each individual cell is causing this reaction to happen. Consider this little red circle a cell, and the laser is basically these yellow photons of energy going into it. As these photons go in, basically cooking the cellular liquid inside, it expands, and when it expands, it basically ruptures. So you literally have had ablation of a cell, this rupturing of a cell from the energy going into it. Now when this happens, you get that funny smell we all remember in dental school when we were cutting on tooth structure. You get that carbon burning smell, or if you leaned over your Bunsen burner during waxing class, you might have burned some hair on your hand, and it all smells the same. It smells like carbon. Well, this really doesn't smell any different. So just know that you are actually breathing in cell matter that's been exploded basically from the laser energy. So make sure you have proper masks that have good particle filtration. Make sure you're wearing your eye protection so that you're not potentially getting something harmful that's vaporized into the air on your eyes. The only time really it's harmful is if you're using herpetic lesions, but just take that into effect that, use a very high volume suction and wear proper materials. The same when you're doing fillings or silver, mercury filling removals, etc. So laser tissue interactions, we talked about a little bit so far. Let's talk about thermal relaxation. The time in which the laser energy is actually off, in other words, the laser is not firing into the tissues, is referred to as thermal relaxation. This is the time in which the tissue gets to relax and cool down. The reason this is important is because we don't want charring and damage. So the ability to pulse it like I'm showing you here minimizes damage to the tissues. And if you have just a little topical or maybe even no anesthetic, it minimizes the amount of pain, maybe even no pain. But if you have someone that's numbed up and you want to get in and get the work done, obviously you can go with the continuous setting, which is going to maximize your coagulation and obviously your speed and or efficiency. But it's nice to have a pulse setting, which all lasers have a pulse setting. The ability to pulse the energy allows you to have that thermal relaxation, that intermittent amount of time that allows the tissues to cool back down again so they don't have as much thermal damage. But there is still some increase in temperature that's happening Let me back up. Sorry about that. There is some change happening simply by adding in temperature, even though it's intermittent. And so as you have increased pulses, you still get some temperature rise, but at least has a little bit of time to relax in between the temperature going up again. So in other words, if you have continuous emission, the energy is constantly on. All right? So if you have continuous energy constantly on, there is no thermal relaxation. Okay? So having continuous energy would look something like this. If this is basically time of energy going into the tissues, you can see the accumulated tissue heating is going up. So to minimize this effect, so we're not having charring and damage to the tissue, we can do one of a couple things. We can move the laser more quickly, or we can have it maybe on a different setting. A different setting being a pulsed emission. So you'll notice here we're having intermittent bursts of high energy to go ahead and vaporize tissue, but that little bit of thermal relaxation allows the tissues to be relaxed enough or cooled enough that the patient doesn't feel pain and we have less damage to the tissues. So here's an example of that pulse again. And so these intermittent pulses, you'll notice that the curve on this is different than the one we had just seen. So instead of being a progressive line, you'll notice on this one there's a drop-off in between them. So the line actually is a lower slope because you have less thermal rise in the tissues. Now this becomes very important to have a very highly aesthetic area to not be damaged or compromised. We don't want to use continuous maybe as often in very delicate areas. Now your basic laser has a continuous setting and or a pulse setting. More expensive devices, and so AMD has two different lasers. One's about $2,500 and the other one I think is up over $5,000. But as you get into the more expensive devices that most laser companies have, it has a little more variability in adjusting how many times the energy is sent out of the machine. So you can actually get different types of pulse widths and different amounts of pulse energies. So something like micropulses, which you can get in typically a lot more expensive devices, they'll go ahead and make the heat dissipate more quickly, but it's going to cost you a lot more money by having that type of technology built in. And frankly, for most of the things we do in dentistry, you don't need all that. But depending on who you talk to, some people might say you need to spend extra money, but at about $40,000 for that type of technology, it's really unnecessary. So in looking at lasers, just know that typically you want to find a laser that's going to have a minimal amount of power, which basically about 2.5 is all you need really to do everything in dentistry. At 2.5 watts of power, you can use it for frenectomies and gingival troughing and all kinds of wonderful things that you're not potentially doing currently, but your hygienist can use it also for various things like sulcular decontamination or sulcular debridements, which we'll get to all these fun things. But just know that the temperature to the underlying tissues is related to the power and how you're actually moving that device around or how much time you have in contact with the tissues. So you always want to use the minimal amount of power that actually is going to treat the issue you're trying to deal with. You don't want to use a very high power all the time because high power isn't going to be more efficient, but potentially can create, let's say, a little more tissue damage. So the first thing I see typically with periodontists and or oral surgeons is they want to put it on the highest number possible and see if they can drag the laser tip through the tissues the same as they would with a scalpel. And that's not the case. It doesn't work like that. It takes a little bit of a technique to understand how to move the device back and forth over the tissues to get them to do what we want. It takes you all about 5 to 10 minutes to figure out. But without any training, you might just use it like a scalpel and find that it doesn't work the same. My best analogy for it is using an end cutting diamond to cut a cavity preparation versus a typical all surfaces coated diamond that you can cut a preparation very quickly. A laser is kind of like that. It cuts only at the tip. It doesn't cut up the whole length of the fiber. So that's one thing to remember when you're using a laser. Now, we see lasers throughout dentistry in many different things, whether it's diagnostics for like cavodiagnodents, for doing actual tooth removal with various types of hard tissue lasers, maybe in a lecture, they're using a diode laser to point at the screen. There's a lot of different soft tissue management we can do throughout all the different specialties, and even cold lasers are used nowadays in TMJ therapy. So a lot of different ways in which you can use lasers. Just know that a diode laser can be used by everyone in dentistry, including specialists, to manage tissues for many different things. So as I mentioned earlier, you get a change in the tissue. And the first change you'll see is potentially coagulation at 60 to 100 degrees. From there, you will find vaporization above 100 degrees. And other things you can use lasers for, obviously like hard tissue lasers, you can get disruption of the tooth structure. You can get chemical reactions happening in composites with lasers. There's a lot of different ways in which you can use these. But the one that's really interesting is biostimulation. So every time we're cutting on tissues, we're getting some biostimulation. We're going to get pain relief. We're going to get better wound healing. We're actually going to propagate collagen growth. So you're going to get better responses anytime you're working on any tissue in the mouth. And as we talked about in the very beginning, it seals nerve endings. You don't get any histamine or bradykinin release to create discomfort. It's sterilizing the area as you're working. You're getting that biostimulation I just mentioned. You're getting penetration at the cellular level. So it's going to maybe be a little bit slower initially compared to a scalpel, but you can be extremely precise and actually get to see where you're working and not have any bleeding. And for the patient not to have any discomfort afterwards makes them very happy, obviously. So traditional tools, scalpels and burrs to modify tissues. You get instant bleeding. You can't necessarily see where you're working very well. It's a little more invasive or aggressive on the patient. It takes longer to heal. You have more risk of infection and discomfort. And obviously there's a lot more potential risks when you're using them. So as I mentioned earlier, a lot of lasers on the market. What are things to look at? Well, we talked about the fact that you don't need ones with all the bells and whistles and a lot of extra horsepower. And to some extent, like I said, AMD's at $2,500 is very inexpensive. Really, there's nothing else that's that low on the market. But one of the other things to think about is how the energy is delivered from these boxes. And so with most laser systems, there's some type of fiber, and then there's a handpiece at the end of that fiber. Now, what we typically had to do with lasers back in the 90s and early 2000 was what we called fiber management. So when the energy comes down the silica fiber and comes out the front of this handpiece, you have to actually manage this fiber, the same as you have to clean your burrs, unless you're someone who throws them away after each use. But if we took a close-up of this fiber, it has 3 layers. So typically with your fiber, you have the outer coating, which is known as the jacket, and then you have an inner coating, which is kind of like a mirrored surface that protects the fiber. It's called a cladding. And so that mirrored kind of lining allows the energy to bounce down a bended silica fiber without bleeding out the side of the fiber. So the fiber being in the center, you have these 3 components. Now, when you have a laser with a bare fiber like these, you have to first start by stripping off the protective jacket or rubberized coating. And so you get what looks like a wire stripper, and you place it on the end of the fiber, and you actually strip off this rubberized coating. By taking off that coating, you've now exposed more of the fiber, and that fiber, again, is coated with a cladding. That cladding has to be scarred or scratched, basically, with a diamond-tipped instrument, the same as you'd cut glass. You're going to make a little score line on there, and that score line is going to allow you to break this silica fiber, which is basically kind of a piece of glass, to break it so that it's clean and smooth. And so by shortening the fiber over time, eventually you'll have to buy a new fiber. But having to manage that isn't as easy as I'm showing you here, because most of the time when you cleave that fiber and try to break it off, it doesn't break off smooth. You usually get a little shard hanging off of it. And so the light coming out looks more like a comet rather than a perfect circle. And so a comet doesn't have perfect energy going down in the tissue, and to some extent you're going to get an irregular cut, and you're getting energy bleeding out to the side. So learning how to perfect this technique takes a little time, and working in the operatory, it takes more time to have to manage. These are things we don't want to have to deal with. We want things to be quick and easy. So lasers like these that are on the market, there's nothing wrong with it, but at 8 to 12 watts is more energy than you'll ever need. If you're a surgeon, maybe you would want that on one day out of the year, but for the most part, none of us need it. From there, you'll notice the fiber spool there has a handpiece. You have to pull this fiber out every time you use it to go ahead and cleave and manage that fiber. So we don't care for these types of things because of time being very precious to us in the operatories. For the same token, Ivoclar and other companies have very similar type products. Again, fiber management. So in managing these fibers, it's going to take more time. So ideally, to get away from this, to save a lot of time and headache, we want to make something that doesn't have to have fiber management. So disposable tips are huge. This is kind of like going from the old flip cellular phones to something like an iPhone. It's just a night and day difference in technology. To be able to just remove one of these tips and throw it away when you're done, it makes life very easy. And for the same token, you don't have to manage the fiber by cleaving anything off or scarring it. Any of those things I just mentioned, you don't have to do. So it's a big time savings. And again, AMD lasers have the ability to take these tips on and off. They're disposable. So you don't have to do any fiber management, and they have different color-coded tips based on what you want to do. If you have a deep sulcus and you're using it in hygiene therapy versus maybe using it around the posterior tooth and doing some troughing, you may want different lengths of the fiber. So it makes it real nice and convenient. You can mix and match quickly and easily. Now for the same token, this portable device, which is very lightweight and small, can be moved operatory to operatory very quickly, and it has a wireless foot pedal. So you're not worrying about a bunch of wires to plug in everywhere and having to trip over things, etc. So very inexpensive, quick and easy to utilize to get from one room to the other, or potentially put them in multiple operatories, again, because they're so inexpensive, as you'll see. Now to look at various companies that are on the market, AMD lasers, many of you have probably seen over the years. They've been doing extremely well. They're the #1 seller of lasers out there, and they make a phenomenal product. Dentsply recognized this, and Dentsply purchased them. So now you have an extremely large international company backing AMD lasers because they bought it. So you now have Dentsply backing the whole thing. You get some amazing hands-on information through various types of iPad apps, DVDs, webinars, information over the internet, lots of places to get information to learn how to utilize this device. So you don't just buy something and potentially let it sit in the corner because you weren't trained well enough. There's a lot of great training by a lot of wonderful technicians out there. So just know that you've got a big company, Dentsply, backing AMD to give you all the knowledge you need to make this happen for you. So I know all of you are probably dying to see what it can truly do, but you had to understand a little about some of the information behind it before we can just dive in and start seeing procedures. So with that being said, there's a lot of benefits, as I mentioned: precise tissue incision, excision, and ablation, less bleeding and infection, minimal pain, very convenient for the patient, and it enhances your practice, as you'll see, to get to a lot of things that you haven't been able to do potentially, or you've had to deal with it in other fashions. From there, as I mentioned, we look at the biopsies, minimal to no healing, shrinkage. We don't have to worry about hitting metals or adjacent teeth and devitalizing things and causing problems. So we're going to be a lot more productive, and we're going to make more money and have patients that are happier because they got done more quickly and have less healing problems and less discomfort. And I'm going to warn you that these become very addictive. And if someone takes this out of your practice or it breaks, you'll be very upset that you don't have something to back it up. And that's the nice thing about, for $2,500, you can have them in many operatories. And so me, spending $35,000 back in the day and buying all these different lasers over many years, they've all done the same thing. They've reduced tissue, but at $2,500 nowadays, it's ridiculous and how amazing it is you can do something inexpensively. So with your laser, when you get it out of the box and you're going to start working in patients' mouths, there's two ways in which you can utilize it. And I'm going to show you those in the next slide. But you have what they call an initiated fiber and an uninitiated fiber. Just know for the majority of procedures, we're going to use an initiated fiber. So the first thing we're going to do in our technique is obviously turn everything on, and then we're going to prepare the fiber, which I'll show you in the next slide, to make it initiated. From there, you're using a light brush stroke. Remember, you're going down cell layer by cell layer. Like an end-cutting diamond, you have to move back and forth slowly, moving down through the layers. You can't push an end-cutting diamond 3 millimeters down a proximal box and then expect it to drag sideways out to the facial. It won't work. The same thing with the laser. So there's a slight technique you have to learn, but it's quick and easy. So you want to use the lowest possible setting so you're not charring the tissue, you don't have as much damage to collateral tissues, and you get better healing and faster healing. From there, if you have little tissue tags, if you want to scrub a little hydrogen peroxide on them, they'll fall right off. And some people like to put a little vitamin E oil just to make things a little healthier and nicer for healing, but it's not necessary. So the initiated versus uninitiated or non-initiated, this is what I'm talking about. Non-initiated, the laser energy comes right out the tip of the fiber without ever stopping, let's say. There's nothing on the end of that fiber, so you're just getting heat and energy coming right out the tip. From there, an initiated one, which you'll see on the right-hand side, initiated ones you can take little black markers, you can take your articulating paper, I've seen people do it with tongue depressors, but basically you're going to put a little mark on the very end of the laser. So you're going to hold basically this stick or articulating paper on the end, touching the end of the tip. You're going to step on the foot pedal, and you're actually going to put a little black char on the end of that laser. So what you've done is you've now focused that laser energy right on this black spot. So if you think of an hourglass, this is the very center, the tiniest little spot on that hourglass where all that sand is focused. Well, you're having all that energy focused right here at that tip. So this tip is kind of like a hot knife at this point. So the energy is going to be very powerful at this particular position. And if you take it off the tissue, you're going to have less change in the tissues. You'll see less vaporization, and so you want to keep it in contact with the cell layers as you're utilizing it in an initiated mode. Okay, so we're going to go ahead and vaporize, remove tissues. So this is what it looks like. So here's a piece of articulating paper, and this is a fiber that I'm actually going to hold on the end of the articulating paper. And after touching the articulated paper and stepping on the foot pedal, the laser energy coming out is going to actually leave that little black scar on the end, which you can see. So now that tip is focused and initiated, as we call it, and I can now go in and start dealing with tissues like this. So how many times do we see patients that have fibrotic hyperplastic tissue around a tooth that we need to get out of the way to do a filling or an inlay or a crown? So we have to remove that. And in dentistry, what do we use? Potentially our burr hits it and makes a big bloody mess, or we have to get out an electrosurge out of a closet somewhere, or we get a scalpel out. All these things take a lot more time, and then we have to manage bleeding. So now we're having to use various types of astringents. We're using a lot of extra maybe anesthetic with high epinephrine content. Maybe we're packing cords in there that are soaked in epinephrine, or we're using various retraction pastes and things. A lot of different stuff out there. So to go in here quickly and easily to remove this tissue is going to make life a lot easier for us. And to remove that tissue and at the same time have a clean area in which to work is going to make our impression taking that much easier, or our direct composites. Now, for example, something like this, if you're going to do a crown or a very large onlay restoration, you know when you get in here you're going to have to manage tissues, especially down in this area where we have recurrent decay happening. You'll notice here we see some tissue tags. You won't find this in most of the other pictures, but I want you to see this. This has a little bit of charring, and these little tiny tags are actually little pieces of tissue that have been vaporized, but they have a tail. They're still connected to the tissue in the mouth. If you rub hydrogen peroxide on a gauze, these fall right off. But potentially, if you do too much of it, you'll have charring of the tissue that won't fall off. So I wanted you to see what charring looks like. Now, this is what a patient looks like when they come back in 2 weeks' time. Look how healthy that tissue is. And you know temporaries under the gum line never look this healthy. It's always irritated because the patient's not cleaning them well. So as I mentioned earlier, you get an area after using a laser in which bacteria cannot grow. So you've sterilized an area, and it's basically a desert for bacteria. So nothing's growing there to create inflammation and irritation. So it allows you to go back in and cement your final restoration quickly and easily without irritations. But you also can remember I said it shuts down the lymphatic system. So if you have any bits of crevicular fluid coming out, you can seal all that with the laser. You don't have to touch the tissues. You just need to hold the energy over it to weld the lymphatic system shut so that you actually have a dry environment in which to adhere your restoration. Now, things like gingivectomies are fun and easy, but what about gingivoplasties? To basically go in and modify tissues to make it easier to work in our regular everyday environment, to gain access maybe to areas under the gum line where you used to have to pack cords, to place composites or take impressions, maybe just to modify some tissues to make things prettier while you're working, to give the patient a better final appearance. So things like this, where potentially you'd have to pack a cord and take more tooth structure away, extending your margin out to the facial so that you could then have access to place retraction cord and get a metal instrument in there to actually pack a cord in between these teeth. So you'd have to make your margin go under the gum line, and you'd have to extend your axial wall out facially. So you're taking more tooth structure away of an already healthy tooth at this point. Why take away more tooth structure if we don't have to? So potentially just to laser some tissue out of the way to give me room to capture an impression is going to make life easy. And if I touch the adjacent tooth, it's okay. I'm not going to devitalize it. So cementing something like this, the same thing as I said earlier, making cementation easier by stopping the lymphatic system is going to make it so that we don't have any circular fluids coming in. So looking at something like this preparation, we've got a little inlay here, or maybe it could be a direct composite. You know, having to extend margins out further to gain access to place cords takes a lot more healthy tooth structure away and makes things more compromised as far as best health for the patient. You have more pressure on the materials, more long-term potential risk for failure, and you have more exposed margins in which to have microleakage and or sensitivity. Now, when we see people come back and you take the temporary off, how often do we see tissues like this that are bloody and irritated? And the second you floss in there or touch that with some etchant or adhesive, it starts to bleed and instantly compromises everything you're working on. So again, to vaporize these areas to stop the bleeding in lymphatic systems makes life easy. But from there, there's things we may not be doing as much of, various types of biopsies and excisions. To go in there quick and easy and not create problems for the patient, to let things heal faster, to not have to maybe suture, to have less bleeding. Here's some examples. Here's a patient that came into my practice, had a cyst in her lip. And you remember I said that sometimes you get actual shrinkage of tissues. Notice how much extra tissue she has, and watch how this tightens up. Basically, I'm going to go in here and expose this area, and by putting actual tension on the tissues, you'll actually cut faster. So you can see now the cyst is isolated. I'm pulling on the tissues. I'm going to make one cut across the top of this. And in making this cut across the top, I'm obviously going to expose the cyst inside. And after exposing it, I can go ahead and pull it out with a pair of tweezers. And then I'm going to go back in after pulling that cyst out and vaporize the top layer of tissue and basically put what I would call a surgical Band-Aid with a laser on here. And so I'm going to get these little tags rubbed off with my 2x2 gauze and some hydrogen peroxide. So here's day one. Notice what her lip looks like. It's a pretty big defect. Most people will be very concerned and probably want to suture it up. The more you've used lasers, the more comfortable you can be in judging who you want to put sutures in or not. But most of the time you don't have to. So that big of a defect, watch what it looks like in just a few days' time. Pretty amazing how fast things can heal, but you also get that contracture of tissues. Now look at day 10. Still a little bit of red mark there, but look how fast that's gone. You'd be taking sutures out at this point. Now what about tiny things like this? You know, how many patients walk in with some little thing that really we have no tool to treat? You know, most of the time we look at a little hypertrophied papilla and think nothing of it and tell them don't worry about it. But what if you had a tool and you could charge them a couple dollars and make their life better by removing the little insult? Take you 2 seconds and you don't even need topical. So lots of things from big to small that maybe we don't treat simply because we don't want to go through the effort of maybe numbing something up, using a Bovie or electrosurge or getting a scalpel out for something insignificant. So a lot of times insignificant tissue things just get looked over. What about gingival troughing? This is a thing I think that most people really want to hear about. Obviously going in here and removing tissue to make it so that we don't have to pack a cord or numerous cords. You know, if you're a double cord technique kind of guy and you're doing lots of teeth, certainly to do all those is a big hassle and a lot of time consumption. And when you finally pull the cord out, you're hoping it doesn't bleed somewhere so you can get that impression. Now, what if you could go in there quickly and easily and just vaporize some tissue, exposing the margins so you can see exactly where you're working. You can see there's no bleeding happening, and enables you to get an impression every time the first time. Makes life easy. We saw this one earlier. Again, simple things that happen every day in our practices that you can deal with in a moment's notice, and it take you seconds to manage. What about something like this one? You know, hypertrophied, bloody, irritated tissue that you're going to have to manage, and it's a pain to do so. Again, putting different cords in, astringents, more epinephrine in your anesthetics, various pastes, a lot of things to have to deal with. We all do it, and we've been doing it. With the lasers, you don't have to. What about this one? You know, just had a root canal done, irritated tissue, big cavity in it. You've got to build it up and then get an impression the same day. You know, a lot of times I'd temporize these and send them away because the tissue was so irritated and I didn't want to have to manage it. And with lasers, obviously, we can get around all that. Same type of thing here, you know, very small confined space. What would you do with the tissue if your margin had to be placed right up against this gold crown? Would you lower your margin under the gum line to give you more room, basically to get your cord in there? I wouldn't want to. I want my margin above the gum line as far as it can be so I have the best possible adhesion. I don't have to worry about bleeding at cementation. What about composites, class 5s? You know, you see these fail at the gum line, they turn brown and leak and have problems because of contamination. Even if you're packing a cord in there, this is usually where you see them fail. What if you went in with a laser first just to manage the fluids in the tissue to give you better access? These are all things we do every day that you can now manage very quickly and easily. But on your aesthetic cases, it's fun too. You know, simple cosmetic contouring makes life quick and easy, doing all the wonderful things we've already talked about as far as modifying tissues and fluids, but also making it so you can do more things for your patients. Little things that they want done, you can now handle. So here's a patient just got out of braces. Teeth are lined up awfully nice, but you'll notice number 7, the gum line has a little bit of maybe an altered passive eruption. The gum line followed the tooth down a little bit. Patient's not happy with it. It's a minor thing, but out here in California, people don't like these things. And I'm sure in many parts of the world, if you explain to them how you could modify it in just a few minutes with some topical, they'd be very pleased and happy to spend some money. This particular patient happened to be an old girlfriend. And it was quite funny. At night, she never felt a thing until she brushed her teeth. When she brushed her teeth, she actually hit the spot and had a little discomfort. Instantly removing the toothbrush, the pain went away, but she almost forgot it was even there, hence her brushing it with a toothbrush. So here she is before. And so I made a little mark with a surgical pen, went ahead and took away the tissue, thinned it down a little bit, and here's the before and after. You'll notice it still has a little bit of redness a couple days later, but you can see a quick improvement in a matter of seconds. What about uncovering implants? Most of us are doing implants nowadays. You don't want to damage the implant or the bone around it, but you can go in with a laser and not have to worry about damaging anything. You can actually see where you're working because you're not having any bleeding. You can modify the tissues quickly and easily. So uncovering implants becomes very easy. Or maybe you have to take an impression and you have a little hypertrophied tissue. You can get that out of the way as well. For those of you who like doing ortho, I'm a big fan of quick orthodontics, various things like 6-month smiles. You can go in here and modify tissues, expose areas, maybe get frenums out of the way. It makes orthodontics a lot easier. What about frenectomies? I did these in dental school a couple times. You go in there and you cut things with a scalpel and it's a bloody mess and you have to suture things. What a nightmare that is. I wouldn't do them again. I sent them all to the specialist. Well, you can do these in a couple minutes, faster than your specialist, and you can charge the same fee. And so which would your patient rather have? Someone going in with a scalpel and cutting you and having postoperative discomfort and sutures, or going in with a laser in a matter of just a few minutes and placing some anesthetic if you want, or if you're really good, you might even be able to place topical. But you can isolate this area, put some pressure on the tongue, and you'll notice here the little arrows next to the frenum. I'm going to get this frenum to lengthen as I'm moving back and forth across this. I'm going perpendicular to the fibers. I'm not going parallel to the fibers. I'm going perpendicular back and forth. And as I'm making a cut, the tongue is actually getting longer. So you can see here the before and after. All my hygiene patients stick their tongue out to see if they have any frenum attachments, and we also pull on the lips. You can get someone who's tongue-tied, untongue-tied in a matter of minutes with virtually no discomfort and no postoperative sensitivity, or very minimal postoperative sensitivity for some patients. But to give someone range of movement is a wonderful thing. As I mentioned previously, traditional techniques, you have a lot more problems with discomfort, sutures, bleeding, and potential risk of infections. So to get around all these things, lasers can do that. What about aphthous ulcers, canker sores, or herpetic lesions? I'm sure many of you out there have experienced a patient with these. They're extremely painful. They last for like 2 weeks. I've never had one, but I hear they're very painful. What if you could treat these patients before it erupts or after it's erupted? You can go over it in a matter of just a couple minutes. You do this again with an uninitiated fiber. Everything else I've showed you for vaporizing tissues is initiated fibers. So with an uninitiated fiber, I'm going to go over this area and just put energy into it, and it's going to go ahead and arrest the problem. So again, this is uninitiated or non-initiated. This is the left side. So energy is just coming out. It's not being initiated. So here's day one at the top. You can see it's kind of dried after putting a laser on it and heating the tissues up. It just kind of dries up a little bit. Day 3, you can see it looks like it's almost gone, but the patient had pain relief in a matter of just a couple minutes. Now look at this one. This was the worst one I've ever seen. Now this one, it took me about 5 to 8 minutes because there's no markings when you're going over this with a laser. So the patient basically tells me once they're pain-free, and then a few days later they come back and it looks perfect. But you can imagine the pain relief they get. There's nothing on the market that can give you that type of relief instantly. All you have is various type of topicals that help for 5 to 10 minutes. Now, hygiene is another great place to implement this. My hygienists have used all types of lasers over the years, but the diode laser is the nicest because it's so small and convenient. You can get in and out quickly. So in using this as an adjunct tool to your traditional scaling and root planing and piezo and ultrasonic treatments, this is basically to help eliminate microbacteria that you may not be removing, obviously, in traditional debridements with your hand instruments, but you're also at the same time going to remove the diseased epithelial lining. So there's a lot of things you can do with this that you're not doing with current techniques. So you're decontaminating to get rid of the bacterial biofilm. You're also removing the necrotic diseased tissue that is in the sulcus. And in the same fashion, you're decreasing the inflammation area. You're stimulating to heal faster. You're getting potentially an attachment gain. And you have an area in which bacteria can't grow for 2 weeks or longer. So you're getting an area in which basically is that bacterial desert, so the body can heal itself. So again, at 50 degrees, just by putting it in the sulcus and not touching any tissues, again, this is uninitiated, so the energy is just coming out, you're killing bacteria. If you happen to touch the tissue a little bit, that's okay. you're not going to damage the healthy tissue underneath the diseased granulation tissue. But you are going to be able to go back after cleaning the root structure and sterilizing the pocket. You're going to be able to go back and actually remove the diseased epithelial lining in using a different setting where you actually initiate the tip. So again, cellular decontamination is to kill the bacteria first. So we're just putting heat into the area to kill the bacteria. But then going back in and debriding the area by using an initiated tip to go ahead and remove that diseased epithelial lining so you have healthy tissue underneath exposed and free to be stimulated and heal quicker because of having a sterile environment. So a quick review of this, obviously when you're going and treating your patient, they're going to be anesthetized for doing your scaling and root planing. But if you're not doing scaling and root planing, you're just going to use some quick hand instrumentation, you may not use anesthesia, and that's fine. You don't need anesthesia for most people when you're using this laser therapy. But the first thing you're going to do maybe is go in with some various types of mouth rinses. You're going to then go in with your laser on an uninitiated setting to kill the bacteria in the area. Then you're going to go back into the pocket with your various types of scalers and hand instruments. From there, you're going to go in and use your laser with an initiated setting to go ahead and actually remove tissue at this point. You're removing that diseased epithelial lining. After doing that, you're going to go back in and then treat it with an uninitiated tip to go ahead and, again, sterilize the pocket one more time. And then for some people, they like to irrigate with various things like iodine or chlorhexidine, whatnot. Some, again, like to rub some vitamin E on there. And obviously give your patient post-op instructions and see them at the next visit. So this type of thing is amazing in what it can do for my patients as far as getting the pocket reduction down. Now, if someone's not cleaning their mouth or changing their habits, it's not a panacea to fix everything. It's for those patients that are taking it upon themselves to go ahead and change their approach of how they're cleaning their mouth. This tool can help them to have a better response so they don't need to go to the periodontist and have crown lengthening surgical procedures to eliminate pockets. So a lot of different ways in which a laser can be utilized. Whether it's gingivectomies, there's CDT codes for those, frenectomies, which most of us probably don't do, but you can with a laser, obviously, uncovering teeth, doing operculectomies, doing various biopsies, maybe implementing in the hygiene department, your aphthous ulcer treatments at anywhere from $25 to $75 a treatment, replacing your cord packing techniques, or just helping out in modifying any tissue when you're doing restorative dentistry. There's a lot of things you can do with diodes. And a lot of these we can manage with other tools, but it takes us a lot longer and it's a lot more challenging versus having a tool that's meant for treating all of these different scenarios. So advantages to you in having a laser, it's obviously going to make things faster and promote better healing. It's going to be a wonderful addition, I can tell you already. Simple to implement and use, precise and very predictable results. Patients love it, and to have new materials and things for patients to see, they start telling friends. So it's a marketing tool at that point. So it's helping you out gain new patients, potentially more revenue. But it's wonderful because it's a win-win. The patient's gaining a lot of things from it. You're gaining a lot. It's a win-win for everyone. So to have less problems, less invasive, less time, no gingival recession, less bleeding, less problems, and to get a return on investment for your $2,500 is just amazing. So all the different things you desire to have out there, well, those are great. You can get those with the right types of investments to help your practice thrive and grow. To get those different things that you desire, you've got to have a good sound investment, and I think a diode laser is just that. AMD makes a phenomenal laser backed by a big company. Now, from that standpoint, there's a lot of things we purchase and we realize maybe don't work for us. This is one thing where I would tell you they have a money-back guarantee where they will put it in your practice. I think it's 30 days. But get it in your practice. Try it. Cost you absolutely nothing. You can do as many procedures as you want. Take that revenue you made from those procedures and put it in your pocket. At that point, you can give the laser back. You just made money and made patients very happy. So it cost you nothing and you made money. Now, think of it once they take it away. This is going back to your loops, your various digital x-rays, your endodontic handpieces, whatever the case may be. When they take it away, you're going to feel like you're in the dark ages. It's an amazing tool, and once you get it, it's very addictive. I promise you that. Now, with that being said, I thank you so much for coming out tonight. If you have other questions for me, feel free to get a hold of me. My email's there. My phone number's there. I don't have my Facebook up there or my Twitter, but I'm on all those things too. So I want to thank you again for coming out. I hope this was very informative, and I look forward to any questions you may have to ask me as I'm going to stay on the line for another 10, 15 minutes to answer those questions for you.
Wonderful. That's a great transition. And thank you so much, Dr. Snyder, for that presentation. And during the presentation, many of you submitted questions, and you can continue to do so now. We may not get to all of the questions in the time allotted, so if your question is not answered here, you will receive a response via email this coming week. But with that, let's go ahead and get started. So why don't we start with one question. Dr. Snyder, how would you go about billing for laser procedures? Could you provide an example of that?
Well, I showed a couple CDT codes on the slide a minute ago, and so what I was going to say is, let me pull that back up, push this out. Okay, so we have CDT codes because most of us are insurance-based. So there are codes you can utilize, whether it's a gingivectomy you'll see here. There's a CDT code for that. If you're doing 1 to 4 teeth or 4+ teeth, you can charge whatever is your insurance company allows. There are codes for that. Frenectomies, there's a code for that one as well. So I charge this out as a normal procedure. Now, the insurance companies, they don't know if I'm using a scalpel or a cautery device or a laser. They have no idea. But it is a procedural code that you can utilize, albeit the only codes that aren't there is for if you're packing cord and you're replacing that with a laser. There's no cord replacement CDT code. There's no aphthous ulcer code. I charge them an office visit or a limited exam, one of those small codes. From there, the hygiene department, if you're going to implement it into hygiene, you can either just raise your fee a little bit, but if your insurance company obviously doesn't allow you to raise your fees, then you can put it in as an adjunct code, which oftentimes they won't pay for, as we all know. Or I'll just tell the patient, hey, I've got a great tool here. It's going to help you out. It's going to cost X amount of money more. If you want it, that's what it's going to cost you out of pocket. If you don't want to use it, you have more risk of potentially going and seeing the periodontist and having them use a scalpel to create bigger problems. So I take that back. They do a great job, but no one wants to go get their tissues cut up with a scalpel. So most people would be interested in doing that. So that's how I build these different codes out.
Excellent, excellent. And multiple times throughout the presentation, you mentioned really bringing this into the hygiene department. And so there is a question, if there's any other types of specific information you could provide, maybe about how to properly frame this conversation with the hygienist in your practice, or how to kind of get them on board with this, or what your experience has been with that. So one of the questions here.
I think most hygienists are always looking to be delegated more. If there's something that can make their life easier and get better results, because let's face it, in the hygiene department, we don't see great results all the time. That's why 80% of Americans have gum disease. But if we had a tool that potentially, eliminate a lot of that and to make life easier, certainly it helps out. And so to show this to the hygienists, I think most of them get on board and are very excited about implementing something new. So I've seen very positive things with all the hygienists I've worked with in teaching as well as in my own practice. So I think it's a great thing to implement that most are very interested in doing. But if they're on various types of incentive bases, obviously it's something that benefits the patient and can truly be utilized for that purpose. And incentive-wise to the hygienist, they obviously can make more money if they're doing more procedures that are helping the patient.
Excellent. And I know that you had a couple of slides that addressed this earlier on in the presentation, but there is just an additional question about the difference between initiated and uninitiated procedures, and just any other examples that you can provide to offer some clarification.
Okay. Initiated fiber is what we're doing the majority of our work with. You have to actually activate the end of that tip, put a little char on it, so that when you touch the tissues, it'll focus energy right on each individual cell that's touching it, allowing it to be vaporized. If you don't initiate the tip and you go down and try and touch the tissues, you won't see much of anything happen. Now, if you leave it there long enough, the tip will eventually get initialized because you're going to start burning things. But to use it uninitiated is when we use it for aphthous ulcer treatments and various types of herpetic lesion treatments, where we're just trying to put energy into the area to stop the discomfort and disrupt the whole process. So for the most part, you have two different activations. But the one being more important is the activated tip, in which you are actually treating most of your actual removal of tissue treatment.
Excellent, excellent. And one final question. We're not going to be able to get to all of them, but in terms of price, and very early on you mentioned the first laser you bought versus the very reasonable price for AMD's Picasso laser. And so one of the things that I think comes up quite frequently is the price is really good, but also in addition to looking at price, it's not like you're sacrificing quality for that price. So in terms of what any dentist should be looking at in terms of key features or key commitments from the manufacturer when purchasing a diode laser, what are some of the things that you think they should be asking about?
You know what? You bring up a great point, and I kind of indirectly take it for granted because I've been around lasers long enough and spent, over $100,000 because I know how well these things work. But a lot of the companies previously, when lasers were first coming in the market in the 90s, a lot of those companies were gone, and you had no one to back up your product if you needed another fiber, if you needed a new foot switch, or anything you needed. So to have a huge company like Densply behind it is a wonderful thing. So if I'm looking at a laser company, I want a big manufacturer standing behind the product. I don't want some little thing coming from a small no-name company where I don't know who's going to be fixing it or where I'm going to get replacement parts. But from there, as I mentioned, you don't need a lot of energy, especially if you're new to lasers. The 2.5 watt lasers do everything I just showed you, any type of tissue modification you want to do. So to utilize it on a continuous setting for when a patient is anesthetized or in a very delicate area where you want to use a pulse setting, diode lasers have a continuous or pulse setting. That's all you need. You don't need to spend a lot of extra money for micropulses. Those are very expensive devices and maybe more for surgeries. So a diode laser like AMD's little 2.5 watt Picasso light is really all one needs, and it's a phenomenal tool. And since there's no moving parts because it's a diode, they're very long lasting.
Excellent, excellent. Dr. Snyder, thank you so much again. And with that, we are out of time. I'd like to thank you all again, the attendees, on behalf of Dental Products Report, tonight's sponsor, AMD Lasers, and of course our speaker, Dr. Todd Snyder. If you're looking for any additional information, you can check out AMD Lasers' website at www.amdlasers.com. And also a replay of this webcast will be available in 24 hours. Just visit the same link you used tonight and watch the replay. It's dentalproductsreport.com/webinar/laser-dentistry. So with that, have a wonderful evening.